5 mistakes that you should avoid during the first trimester of your pregnancy. Hi, this is Dr. Abinaya Vijayakumar, your post-pregnancy expert. For those of you watching me for the first time, I take post-pregnancy classes to pregnant women where I teach them how to stay happy and positive throughout their pregnancy in order to come out of a stressful and anxious-filled pregnancy. I have trained more than 2,000 plus pregnant women and I have testimonials of more than 100 plus happy women. Do check out my Instagram page, Mommy with Bigger Dreams, and support me reach my mission of guiding 1 million pregnant women to have a happy and confident pregnancy using simplified Garb Sanskar techniques. If you're new to my channel, kindly take 1 minute of your precious time to subscribe to my channel and press on that notification bell icon so that you receive regular updates on upcoming videos in my channel. I post regular videos on pregnancy and motherhood related topics. With no further delay, let's jump into the video. Number 1, not visiting your doctor as soon as you know that you're pregnant. Many of the pregnant women still does this mistake of visiting the doctor after 3 months or 4 months of pregnancy. This is not a good habit because you need to confirm if it is an intrauterine pregnancy, which means that the baby is formed inside the uterus and not ectopic, that is outside the uterus like tubes or ovaries, etc. Because if the pregnancy is ectopic and it is left unnoticed, this can be life-threatening to mother. Always visit your doctor as early as 6 weeks during your pregnancy, but even before that, if you face severe abdominal pain, giddiness, syncopal attacks, or excessive vomiting, do consult your doctor immediately. Number 2, not taking your prenatal vitamins. Many women, because they reach out to the gynecologist very late in their pregnancy, like 3 months or 4 months, they tend to miss out this important period of not taking the folic acid. Folic acid is very essential for baby's brain development. This is usually crucial during the first few weeks of pregnancy. We do something called NT scan, that is nuchal translucency scan, between 11 and 13 weeks of pregnancy. So if the mother is not taking the folic acid during the early weeks of pregnancy, this can lead to neural tube defects like spina bifida, anencephaly, etc. So do consult your doctor as early as possible and start taking the prenatal vitamins, especially folic acid during your early weeks. Number 3, ignoring severe vomiting. Many of the mother does this mistake that even if they have severe vomiting, they tend to think that this is completely alright in first trimester. Of course, vomiting is completely normal and physiological during the early weeks, but there is a threshold. If you lose more than 5% of your initial pre-pregnancy weight, this is an indication that your vomiting is not just a physiological thing, but it is severe, which is called as hyperemesis gravidorum. Here you need IV medications and IV fluids to hydrate you and support you to have a better health. So if you have severe vomiting, like vomiting even after every meals or even after drinking water, then you need to consult your gynecologist to rule out hyperemesis gravidorum. 4th is sticking to your bed all the time. Again, many women does this mistake of resting in their bed throughout the day during the early weeks of pregnancy. So it's absolutely not necessary to rest in your bed throughout the day unless and until you have some medical complications like incompetent cervix or short cervix or IVF pregnancy. Remember, babies born to healthy mother, active mother will be much more active and healthier. Next is ignoring bleeding during the early weeks of pregnancy. Of course, some amount of mild spotting or brownish discharge can be completely physiological, which we call it as implantation bleeding, but not all the time you should take it at ease. Do consult your doctor, make sure that their cervical os is closed and baby's heartbeat is absolutely okay in order to name it as implantation bleeding. Brownish discharge can be because of implantation bleeding, but anytime during the early weeks of pregnancy, if you have fresh bleeding or passage of clots, do consult your doctor immediately. Last but not the least, you need not eat for 2. This is a common saying that we hear it again and again from the elders at home, like, you are pregnant, there is a baby inside you, so you should eat for 2. You need not eat for 2. So you just need 300 to 350 calories extra apart from your existing diet. This can be easily met. For example, 2 idlis and 1 cup of sambar can be equivalent to that 300 kilocalories. So you need not eat double the quantity, which is again a blunder mistake. Share it with that pregnant friend of yours if she is also in her early pregnancy, such that she doesn't do these mistakes. Subscribe to my channel to get regular updates on upcoming videos in my channel. Comment below your doubts about early pregnancy weeks such that I'll clear it at the earliest. Keep supporting me to reach my mission of guiding 1 million mothers to have a happy and confident pregnancy using simplified Garb Sanskar technique. Until I meet you in the next video, stay happy, stay mommified.